the goal is to come up with a time-limited treatment that's not chemotherapy. So you can give a non-chemotherapy treatment to a patient and then stop and then have a remission that for years and hopefully cure the patient. That's the goal for first line. What are we doing to achieve that? There are a number of clinical trials that are combining all these novel agents together, so combination studies. Whether it could be ibrutinib in combination with venetoclax and obinutuzumab. It could be ibrutinib and venetoclax. Studies you look at acalabrutinib and venetoclax and obinutuzumab. Studies looking at zanubrutinib. And so in principle, we are trying to use our best drugs upfront, going for the disease as strong as we can, with the goal of getting rid of every cell of cancer in the body and then stop and then cure the patient or give them years of remission. That's the goal. So a lot of the studies that are happening right now are using combination therapies. That's for frontline, probably the biggest thing. The second category of studies that are happening in CLL world are to just find even better drugs. We have great drugs, but there are still patients whose disease may become refractory or they can relapse after being treated with this great drug. So there are a couple of new categories that are being tested as new CLL drugs. So it could be immunotherapy-based therapies or novel drugs. So those are in development. We have a next generation BTK inhibitor category that those are the drugs that inhibit the BTK enzyme, but with a different mechanism. So you can potentially use them in patients who didn't respond to ibrutinib or acalabrutinib or drugs like that. So that category is growing now. We have studies that are looking at those drugs. We have just new targets like MCL1 inhibitor. I mean, I don't want to name all the drugs, but and then bispecific antibodies, which is a form of immunotherapy, and then more, of course, CAR T-cell therapy. So these are just more effective treatments. So this is our second category. The third category would be drugs that are just safer, maybe not better than the current drugs, but with fewer side effects or with a better toxicity profile. And there's a long list of drugs that are in that category. So in general, combination therapies. Number two would be better targeted therapies or immunotherapy approaches. And number three would be safer drugs. So there's a lot of work to do in CLL. We have been very fortunate to be able to provide a lot of options to our patients, but we shouldn't forget that there's a long way to go. These drugs they come with side effects. They're not 100% effective, so we need to work on both efficacy and safety of these drugs. A lot of these treatments are still given forever, so you have to work on that. And we want to make sure that our patients are both disease-free, but then not on a medication. So clinical trials are critical, and I think CLL. In general in oncology, I think the patient will benefit from if not being followed by, at least to be in close contact with a person or with a center that's focused on their disease, right? So they know what's happening in the field. They know what are the promising trials or new trials that are going on, and they just ask about their options.